name is Dee Polito, and I'm the director of the UK Midwife Clinic. I was a nurse before I became a midwife, and I've been a nurse for 35 years. And I was an obstetric nurse and decided to go to midwifery school. Midwives focus on the normalcy of women's health, and we take care of women through the lifespan, from adolescence through menopause. We do prenatal care, and we focus on wellness, and we focus on normalcy. And midwives will often spend more time with a patient. Midwives consider when it's time for the baby to be born that the woman delivers the baby and we just catch the baby. So we often refer to ourselves as baby catchers. We pride ourselves on being available 24 hours a day and 7 days a week. We are available to our patients when they're in labor. We like to stay with them, and our practice is adjusted so that the midwife who is on call will be available to anyone that's in the hospital. The reality is that 95% of midwives in this country attend women in the hospital, and only a small percentage take care of women outside of the hospital in the home or birth centers. It's really an honor to be involved in an academic institution where midwives are included in the team. We can work with the high-risk physicians, we work with the OBGYNs, we work with other nurse practitioners, we work with the residents and the interns and the medical students, and we're involved in educating physicians about what normal looks like in women's health, in pregnancy, and in birth. I really get a lot of satisfaction when a woman comes to us after a birth that maybe has not been as she desired and maybe didn't go as well as she had hoped. And then she comes to us and she has a different experience and she tells us about it. That's the most satisfying thing for me, is when a woman says, I feel healed and I feel like I've come full circle and I had the birth that I really wanted.